Let me ask you something that might catch you off guard. Do you genuinely believe you understand everything about your masculine anatomy? Every single day in my medical practice and throughout my professional networks, I encounter countless men wrestling with devastating doubts, persistent myths, and overwhelming insecurity regarding their intimate physiology. These individuals navigate entire lifetimes without comprehending the fundamental mechanics of their own masculine equipment. That's precisely why, in this comprehensive presentation, I'm going to unveil the most astonishing revelations about male anatomy that will revolutionize your understanding completely. Before we embark on this journey, allow me to properly introduce myself. I'm Dr. Charles Bennett, a board-certified urologist specializing in senior male sexual wellness, with 3 decades of clinical experience treating thousands of patients. My professional mission through this educational platform is to empower you to achieve maximum performance capabilities with unshakable confidence during your most intimate moments. So please, do me this simple favor. Hit that like button immediately and subscribe to the channel. That's genuinely all I request from you today. Let's dive deep into this content because what I'm about to share will absolutely transform your perspective. I'm going to be remarkably direct and transparent, revealing 8 extraordinary and fundamentally essential facts that are absolutely crucial for maintaining optimal intimate health throughout your lifetime. Fact 1. Pre-birth arousal responses, the factory settings. Here's something that will completely revolutionize your understanding. Male arousal responses actually commence before birth, during fetal development. That's absolutely correct. Masculinity and erectile capability are literally factory-installed features programmed into male biology. Cutting-edge research utilizing advanced ultrasound technology has definitively documented that male fetuses can experience physiological erectile responses while still developing in the maternal womb. Obviously, this phenomenon has absolutely nothing to do with sexuality or arousal. It's purely the autonomic nervous system and circulatory infrastructure running comprehensive diagnostic checks to ensure proper functionality. Think of it similar to those spontaneous morning occurrences, functioning as natural physiological responses, signaling that all systems are operating correctly. What this fundamentally means, gentlemen, is that males aren't biologically designed for dysfunction or failure. We're not engineered to lose firmness or experience inadequacy. When performance issues manifest, it's either a mechanical malfunction within the arousal mechanism itself, or psychological barriers creating significant interference with natural processes. Consider this profound implication. Your body has been practicing these responses since before you drew your first breath. The intricate network of blood vessels, nerve endings, and smooth muscle tissue has been rehearsing this complex choreography for your entire existence. This isn't something you learned or developed. It's hardwired into your biological blueprint. Understanding this fundamental truth should provide immense reassurance that your body inherently knows what to do. Sometimes, we just need to address the obstacles preventing optimal function. Fact 2. The size illusion and comprehensive global statistics. The second revolutionary revelation addresses what research consistently identifies as the primary source of masculine insecurity worldwide: dimensional concerns. This pervasive anxiety, gentlemen, stems almost entirely from adult entertainment industries and the fantasy manufacturing complex, which systematically distorts normal reality to create unrealistic expectations. They would have you believe that adequacy means exceeding 8 or 9 inches as a baseline standard. Listen very carefully to what science actually tells us. Comprehensive epidemiological research conducted across multiple continents, involving hundreds of thousands of participants, consistently demonstrates that the global average ranges between 5.1 to 5.5 inches when experiencing full arousal. This persistent notion that men need to exceed 7, 8, or more inches, it's pure fiction perpetuated by adult film productions using camera angles, casting choices, and digital enhancement. But here's what genuinely matters, and what research proves time and again. Firmness, quality, and endurance capability are infinitely more important than dimensions. Combined with proper technique, emotional connection, and psychological wellness, performance excellence always supersedes proportions. Scientific studies on intimate satisfaction consistently rank size as surprisingly low on priority lists, while factors like attentiveness, communication, and technique dominate the top positions. Focus your energy on optimizing the quality of your physiological response, not obsessing over measurements, especially since you should concentrate your efforts on factors completely within your control rather than genetic predetermined characteristics. Fact 3. Natural angles and critical warning signs. The third groundbreaking revelation involves understanding that slight anatomical angles are not only completely typical, but actually represent the norm rather than the exception. What medical professionals classify as physiological variations are remarkably common across the male population. Minor asymmetries, whether naturally curving left, right, upward, or even slightly downward, are widespread and completely normal variations. Generally speaking, angles measuring less than 20 degrees at their most pronounced point are considered fully functional and require no intervention whatsoever. Without accompanying pain, discomfort during intimacy, or functional impediment, it's simply your unique anatomical characteristic, not a defect requiring correction. Interestingly, many highly successful adult film performers have built entire lucrative careers while having noticeable variations, proving definitively that these characteristics don't impair function or desirability. However, here's the absolutely critical warning that could save your health. If you suddenly develop a pronounced angle that wasn't previously present, especially if accompanied by pain, palpable scar tissue, or penetration difficulty, this could signal serious conditions like Peyronie's disease. This condition involves the development of fibrous scar tissue inside the penis, causing painful, curved erections. In such cases, you need immediate medical evaluation because early intervention dramatically improves treatment outcomes. Don't wait, hoping it will resolve spontaneously. It won't, and delays only complicate treatment options. Fact 4. Foreskin management and comprehensive hygiene essentials. The fourth absolutely critical point involves understanding proper foreskin care and maintaining impeccable cleanliness standards. The foreskin, gentlemen, is that specialized protective tissue covering the glands in uncircumcised men, serving important protective and sensory functions. While it provides valuable protection and maintains sensitivity, it demands consistent, proper maintenance to prevent complications. When difficulty retracting the foreskin creates a constricting ring effect, we're dealing with a condition called phimosis. Phimosis typically requires medical intervention, ranging from topical steroid treatments to surgical correction depending on severity. But beyond specific conditions, maintaining exemplary hygiene is absolutely non-negotiable for optimal health. Neglecting proper cleanliness promotes bacterial overgrowth, inflammatory responses, and fungal infections like balanitis, potentially causing significant pain, discomfort during intimacy, and embarrassing odors that undermine confidence. The accumulation of smegma, that white cheese-like substance, creates an ideal environment for bacterial proliferation and can lead to chronic inflammation if not regularly cleaned. Your local tissue health and hygiene standards are absolutely fundamental for achieving optimal performance when intimate moments arise. Proper cleaning technique involves gently retracting the foreskin during daily showers using mild, unscented soap, thoroughly rinsing away all soap residue and carefully drying the area to prevent moisture accumulation that promotes fungal growth. Fact 5. Penile fracture. Understanding this genuine medical emergency. The fifth shocking reality that every man needs to understand is that penile fracture absolutely exists and represents a serious medical emergency. Despite the absence of actual bones, the penis can literally break during vigorous activity. Penile fracture involves traumatic rupture of the tunica albuginea, the tough, fibrous envelope surrounding the erectile tissue that maintains structural integrity during arousal. The primary causes involve sudden, forceful bending during vigorous movements, typically from misalignment during passionate intimacy. The most frequently reported scenario occurs when your partner is positioned on top and accidentally slips, causing sudden, extreme bending. This creates an audible snapping or popping sound. That terrifying sound indicates catastrophic fiber rupture, causing immediate, excruciating pain and instant loss of firmness. Since arousal involves highly pressurized blood flow within contained chambers, any rupture causes rapid blood escape, creating massive subcutaneous hematoma formation. The visual appearance becomes alarmingly similar to an eggplant: deep purple discoloration with significant swelling. Listen extremely carefully to this next point. Penile fracture constitutes a genuine urological emergency requiring immediate surgical intervention. Every hour of delay decreases the likelihood of complete functional recovery. Don't wait. Don't try to sleep it off. And absolutely, don't let embarrassment prevent you from seeking immediate emergency treatment. Many men experience permanent dysfunction because they delayed treatment due to embarrassment. Professional medical staff handle these situations regularly with complete discretion and professionalism. Fact 6. The hydraulic engineering marvel and cardiovascular connection. The sixth revelation involves understanding that arousal represents pure hydraulic engineering at its finest, a complex interplay of vascular dynamics. For achieving optimal firmness, you require excellent cardiovascular function, meaning your overall systemic health matters tremendously. Unlike numerous other mammals possessing actual bone structures, called baculum, humans depend entirely on sophisticated circulatory mechanics. Achieving rock-solid firmness demands proper cardiac pumping capacity, clear arterial pathways, and healthy endothelial function. Multiple factors systematically undermine your erectile response, including sedentary lifestyle patterns, nutritional deficiencies, tobacco use, excessive alcohol consumption, and chronic psychological stress. Pay extremely close attention to this next point. Weak erectile responses often represent your body's early warning system, potentially signaling significant health problems, particularly cardiovascular disease. Erectile dysfunction frequently manifests years before heart attacks or strokes, serving as what cardiologists call penile angina, indicating compromised blood vessel health throughout your entire body. The same arterial plaques affecting cardiac vessels also impact penile arteries, but because penile arteries are significantly smaller, they show symptoms first. This makes erectile function an incredibly valuable barometer for overall cardiovascular wellness. Fact 7. Natural enhancement through strategic nutrition. The seventh breakthrough involves understanding how strategic nutritional optimization dramatically enhances peak performance naturally. Specific foods contain compounds scientifically proven to boost circulation, hormone production, and overall sexual wellness. Dark chocolate with high cacao content provides flavonoids that improve blood vessel flexibility and function. Watermelon contains abundant citrulline, an amino acid converting to arginine, which enhances nitric oxide production and blood flow. Pomegranates offer powerful antioxidants, supporting arterial health and potentially increasing testosterone levels. Various nuts, particularly pistachios, walnuts, and almonds, provide arginine and heart-healthy fats, promoting optimal vascular wellness. Beets contain high nitrate concentrations, converting to nitric oxide, a powerful natural vasodilator improving blood flow throughout the body. Spinach and other leafy greens supply magnesium, absolutely crucial for healthy testosterone production and muscle function. Fatty fish like wild-caught salmon, mackerel, and sardines provide omega-3 fatty acids, supporting cardiovascular function and reducing inflammation. Garlic contains allicin, improving blood flow and potentially reducing arterial stiffness. Olive oil supports testosterone production while providing anti-inflammatory benefits. These aren't magical instant cures, but consistent daily consumption creates significant cumulative impacts on overall performance capabilities. Fact 8. Exercise, physical conditioning, and performance optimization. The eighth absolutely essential truth connects physical fitness directly and powerfully to intimate performance capabilities. Regular cardiovascular exercise dramatically improves blood flow dynamics throughout your entire circulatory system, enhancing oxygen delivery and waste removal. Resistance training, particularly compound movements like squats, deadlifts, and bench presses, naturally stimulates testosterone production and growth hormone release. Targeted pelvic floor exercises, commonly called Kegels, strengthen the muscular foundation supporting erectile function, enhancing both control and endurance significantly. High-intensity interval training creates beneficial cardiovascular adaptations while improving stamina and metabolic health. Yoga practice increases flexibility, improves breathing patterns, and substantially reduces stress-related performance impediments. Swimming provides comprehensive full-body conditioning without excessive joint stress, making it ideal for older gentlemen. Even moderate-intensity walking for 30 to 45 minutes daily creates measurable improvements in circulation and endothelial function. Remember this fundamental principle: your intimate health directly mirrors your overall physical conditioning level. The fitter you become, the better your performance potential. Beyond these core revelations, numerous lifestyle factors profoundly impact masculine performance that deserve careful consideration. Sleep quality directly influences hormone production cycles. Consistently aim for 7 to 9 hours of quality sleep nightly. Chronic sleep deprivation decimates testosterone levels and impairs vascular function. Effective stress management through meditation, breathing exercises, or professional counseling reduces cortisol elevation, which significantly interferes with arousal mechanisms. Proper hydration maintains necessary blood volume for optimal hydraulic function. Dehydration directly impairs erectile capability. Limiting alcohol consumption prevents both temporary performance impediments and long-term vascular damage. Regular medical checkups identify developing problems early, before they become serious complications. Open, honest communication with intimate partners reduces performance anxiety and strengthens emotional connections. Maintaining healthy body weight prevents circulation problems, hormonal imbalances, and psychological barriers. Temperature regulation matters too. Excessive heat exposure from hot baths, saunas, or tight clothing can temporarily impair function. Mental wellness plays an enormous, often underestimated role in masculine performance. Performance anxiety creates a devastating vicious cycle. Worry generates problems, which exponentially increases worry, creating a self-fulfilling prophecy. Clinical depression profoundly affects libido and physical response mechanisms through neurotransmitter imbalances. Unresolved relationship conflicts manifest physically as erectile dysfunction or premature ejaculation. Past psychological trauma can create powerful subconscious barriers preventing normal function. Pornography addiction systematically distorts expectations and desensitizes natural arousal responses, requiring increasingly extreme stimulation. Professional psychological counseling effectively addresses these complex psychological components when physical treatments alone prove insufficient. Cognitive behavioral therapy helps identify and modify destructive thought patterns. Remember, the mind-body connection proves incredibly powerful in intimate situations. Your thoughts directly influence your physical responses. Mindfulness practices and present moment awareness can dramatically improve intimate experiences by reducing mental chatter and performance pressure. Certain symptoms absolutely demand immediate professional medical attention without delay. Persistent difficulty achieving adequate firmness, especially with sudden onset, requires evaluation. Any pain during arousal or intimate activity warrants investigation. Visible changes in appearance, texture, or coloration need assessment. Blood presence in urine or ejaculate demands immediate evaluation. Discovering lumps, nodules, or unusual growths requires prompt examination. Persistent curvature developing suddenly needs professional assessment. Inability to retract foreskin completely requires medical intervention. Any traumatic injury during intimate activity necessitates emergency evaluation. Don't allow embarrassment or masculine pride to prevent seeking appropriate help. Urologists handle these sensitive issues daily with complete professionalism and discretion. Early intervention consistently produces better outcomes than delayed treatment. Your health matters more than temporary embarrassment. Implementing these insights requires systematic lifestyle modification rather than sporadic efforts. Create a structured sleep schedule, prioritizing consistent bedtimes and wake times. Develop a balanced exercise routine combining cardiovascular training, strength building, and flexibility work. Plan meals emphasizing whole foods, lean proteins, and beneficial fats while minimizing processed foods. Establish stress reduction practices that resonate with your personality and schedule. Schedule regular medical checkups, including comprehensive blood work, analyzing hormone levels, cardiovascular markers, and metabolic health indicators. Build stronger emotional connections through improved communication skills and vulnerability with trusted partners. Address any substance abuse issues that compromise vascular health and psychological well-being. Consider supplementation under medical guidance if nutritional gaps exist despite dietary improvements. Create accountability systems supporting long-term lifestyle changes rather than temporary modifications. Genuinely enjoyed this comprehensive presentation? Then subscribe immediately and comment below describing which fact surprised you most profoundly. Remember, this educational content provides general knowledge only. It absolutely doesn't replace personalized evaluation by a qualified medical specialist. If experiencing concerning symptoms or persistent problems, consult your healthcare provider promptly. Understanding these 8 fundamental truths empowers you to take decisive control over your intimate wellness journey. Knowledge eliminates fear, uncertainty, and destructive myths. Your body possesses remarkable capabilities when properly maintained and supported. Focus on comprehensive health optimization, not isolated quick fixes. Small, consistent lifestyle modifications create profound cumulative improvements over time. Most importantly, never hesitate seeking professional medical guidance when questions or concerns arise. Your health and happiness deserve professional attention.